Sponsored by RxCardClub.com. Get a free prescription drug card and save up to 85% on prescription drugs. RxCardClub.com. When will Opill be available? Opill is expected to be available over the counter, OTC, on pharmacy shelves, retail shops and online in mid-March of 2024. The product has already shipped to retailers as of March 4, 2024. Opill is the first OTC birth control pill available in the US and does not require a prescription. It is manufactured by Perrigo Company. How much does Opill cost? The Opill price has been listed as $19.99 for a 1-month pack, $49.99 for a 3-month pack and $89.99 for a 6-month pack. Perrigo, the manufacturer, has stated that the company plans to make the OTC product accessible and affordable for everyone and expects to provide financial assistance for eligible women. Currently, the cost of prescription birth control is covered under the Affordable Care Act. It remains to be seen if insurance will cover the cost of Opill as an over-the-counter, OTC, product in the US. Most OTC products are not covered by prescription insurance. Congress is now taking steps to require coverage for OTC birth control, but this is not yet finalized. Who makes Opill? Opill is manufactured by Perrigo Company, headquartered in Dublin, Ireland. The North American base is located in Grand Rapids, Michigan. To contact corporate headquarters in Ireland, call +1 353 11709 4000. The over-the-counter, OTC, products division of Perrigo in the US can be contacted at 1-800-719-9260. What is Opill? Opill, Norgestrel 0.075 mg, is the first non-prescription, over-the-counter, OTC, birth control pill, oral contraceptive, now approved in the United States for all ages. On July 13, 2023, the U.S. Food and Drug Administration approved Opill in an RxtoOTC switch. Opill will be available in March of 2024 on pharmacy shelves, in grocery stores and online through the manufacturer. Opill is a progestin-only pill, POP, often referred to as a mini-pill. It does not contain estrogen, another hormone also found in combination birth control pills. Is Opill only available over the counter? Today, Opill, Norgestrel, birth control pills are only available over the counter, OTC, after an RxtoOTC switch in July 2023. This will help to remove barriers to more effective forms of birth control in the US, as buying Opill will not require a doctor visit or prescription. Norgestrel, the active progestin ingredient in Opill, was first approved by the FDA in 1973 and was previously only available as a prescription birth control called Ovrette. The Ovrette brand was discontinued in 2005. A supplemental new drug application, SNDA, for a name change to Opill was approved by the FDA in 2017. How effective is Opill at preventing pregnancy? The OTC version of Opill is identical to the prescription Norgestrel product. Progestins like Norgestrel are estimated to be about 91% effective at preventing pregnancy with typical use, according to ACOG. As with any birth control method, Opill does not prevent pregnancy all the time. Typical use is not perfect use and includes not taking the pill correctly or not using a condom when a pill is missed. In 8 U.S. clinical trials, Opill was effective in preventing pregnancy in 98% of women. Approximately 98 out of 100 sexually active women who used Opill for a year did not become pregnant in that time, according to the product label. Perfect use is usually seen in clinical trials due to the controlled nature of the study, when a pill is taken every day as directed and a backup method is always used for missed pills. Perfect use is not usually seen in the real-world setting. Nonetheless, when used as directed, Opill is expected to be the most effective form of over-the-counter birth control. It is more effective than the condom or spermicide, other over-the-counter options. In addition, the FDA has stated the product can be used by consumers safely and effectively by following the non-prescription drug facts labeling, without any assistance from a healthcare provider. Note: Opill is not for use as an emergency contraceptive and will not prevent pregnancy after unprotected sex. It will not protect you against a sexually transmitted infection. Do not use Opill if you have or ever had breast cancer. If you have questions about how to take Opill, refer to the drug facts label and consumer information leaflet found with your pack, or ask your doctor or pharmacist. Related questions: how much does Opill cost? How do I use Opill birth control? Opill OTC versus other birth control pills. What's the difference? When did the FDA approve Opill? On July 13, 2023, the FDA granted full approval to Opill through an RxtoOTC switch. Before that, in May 2023, the US FDA Advisory Committee voted unanimously 17-0 that the benefits of making Opill Norgestrel 0.075 mg, a progestin-only oral contraceptive, available as an over-the-counter (OTE) option for women outweighed the risks. It will be available in pharmacies, retail shops and online in March of 2024. In the US, close to 1/2 of all pregnancies each year are unintended, and about 1/3 of women have reported having trouble getting a prescription or refill for birth control like the pill, patch or vaginal ring. Access and affordability of safe and effective forms of birth control can often be difficult for many US women. In an FDA Advisory Committee meeting, company representatives stated that in a study of 955 participants, only 6 became pregnant while using Opill. Opill has a long history of safe and effective use. It was first approved as a prescription product in 1973. Evidence has shown that progestin-only pills are effective at preventing pregnancy and safe for most women. Prior to approval, the FDA reviewed several studies confirming that consumers could understand the OTC label and use the Opill product correctly. Removing the prescription requirement for Opill will help to improve access to an effective form of birth control that works better than current OTC methods, including condoms and spermicides. In addition, availability of over-the-counter, OTC, oral birth control has support from major medical groups, including the American College of Obstetricians and Gynecologists, ACOG, the American Medical Association, AMA, the Society for Adolescent Health and Medicine and the American Academy of Family Physicians, AAFP, according to the manufacturer. How do I take Opill? Take 1 tablet by mouth at the same time every single day, and no later than 3 hours from the time you took your tablet the day before. It is important to take your pill at the same time of day. Never skip your daily tablet, even if you do not have sex very often or have a menstrual change. Use a condom, or another barrier method, every time you have sex during the first 2 days, 48 hours, because it takes 2 days to start working. Each pack of Opill contains 28 pills. You can start your pack on any day. Do not take a break between packs. When you finish one pack, all 28 tablets, you should start the next pack the following day. If you are switching from another oral contraceptive, vaginal ring, or patch, start taking Opill a day after you stop the other method. If you have taken an emergency contraceptive in the last 5 days, talk to your doctor or pharmacist before you start Opill. Oral contraceptives do not protect against HIV, AIDS and other sexually transmitted infections, STIs. Use condoms to prevent STIs. This is not all the information you need to know about Opill Norgestrel 0.075 mg, for safe and effective use. Review the full drug facts label and consumer product information and discuss this information and any questions you have with your doctor or other healthcare provider, rxcardclub.com. Get a free prescription drug card and save up to 80% on prescription drugs.